All right, Todd, let's do this. Hello, everybody. This is Dave with HealthJoy. Thank you so much for joining us on this Tuesday afternoon. My name is Dave with HealthJoy. I'm the Executive Vice President of Strategic Partnerships. I'm here along with our co-host from our exciting new partner, Nova, Todd Martin, who will be kicking us off here momentarily. But a couple things before we do so. We are keeping this to 30 minutes or less. Again, we know your time is incredibly precious. We know how boring sometimes long webinars can be, but we will be very sensitive to your time and keep this under the allotted time. At the end, if there are questions, we will answer those. If we don't have enough time to get to them, we will make sure to follow up with the answers to you based on the questions you've asked. And throughout this webinar, if you do have those questions, please enter them in at the bottom in the chat and we will get to you at the end. Lastly, this will be recorded. So for those that attended and would like to hear it again or share it with their counterparts, we will get that out to you shortly following the webinar. And for those that didn't register, we'll get that out as well. But again, thank you so much for joining. We're really excited to share with you this exciting partnership with Nova. And with that, I'm going to pass it over to Todd. Todd?
Yeah, no, thanks, Dave. And also like to reiterate, thank you everyone for taking 30 minutes out of your day to learn more about this new partnership. My name's Todd Martin. I have been with Nova Healthcare for over 10 years, and this is probably one of the most exciting times in our industry, and especially with the partnership with HealthJoy, we're really looking forward to how this can really positively affect the experience for our membership and also, our employer groups. So those of you that aren't familiar with who Nova is, I guess by industry standards, we're really, a TPA, but we really refer to ourselves as more of a trend management organization. So we primarily work through consultants, who many of you may be, supporting your self-funded employer groups and their unique plan designs and their unique strategies. In addition to that, we support a lot of other health plans and TPAs across the country with private labeled solutions. And then we also do a lot of the traditional TPA type administration, like your reimbursement accounts, your health savings accounts, COBRA administration. So we really have a lot of tools in the bucket to really help all of the employers accomplish what they're trying to do. So really, what does engagement mean, to your clients? And that's what we want to talk about today. At Nova, it really means understanding, the employer's goals and what they're trying to accomplish with their benefit plan, then ultimately providing the benefit plan's membership a positive experience that results in controlling costs while improving outcomes. As many of you probably know, consultants and employers across the country are implementing different strategies to try and get some control around the ever-escalating cost of healthcare. And all employers are different. Some are more tolerant to change than others. Some employers need more time to make change, and other employers really have no desire for change. So what does that mean for a Nova or any other independent TPA? It means most of our new clients this year are doing something completely different from what our clients are doing that we brought on last year. And so with that being said, the historical TPA structure wasn't scalable at Nova with the growth that we've seen over the last 5 to 10 years. Historically, you would walk into a TPA, or I guess any other health plan for that matter, you really would have a siloed structure. And when I say a siloed structure, I mean really disconnected, where you have claims in one corner, customer service in another corner, account management in another. And you might even have a medical management team that really isn't even part of your organization. So when you have so many clients and many have their own unique models, from clients using national PPO networks to regional networks to reference-based pricing to direct hospital contracts to direct primary care, plan designs that involve steerage, it's really hard for a customer service representative to be an expert in every one of those areas to help the membership navigate their world of healthcare. So about 5 years ago, Nova really broke down those silos and really developed strategic business units, more of a team approach. And now we have what looks like multiple mini TPAs across our organization that really support, a homogeneous line of business. And on those mini TPAs, you really have everything from the day one implementation manager, a core system implementation specialist. Those are the folks that are building out the plan designs, your enrollment specialist, your care navigator, an operations advocate, and a claims analyst, the nurse advocate, a client account manager, a client account specialist. And then those teams are really led by a strategic client partner, as well as an operations manager. So what is Nova's formula for success? Well, we believe there's an art and science in what we do. And our formula for success balances both to ensure we bring human insight to machine data to create smart solutions to what are universal challenges, and a data-driven approach with better outcomes for the employer, but also the membership as well. We pride ourselves on being more than a TPA, really rather part of your team. We make a habit of really working, I guess, side by side with our clients in all aspects of our work, because really making the employer's goals our goals. And our clients are truly the nucleus of our company. They really sit, I guess, at the center of everything that we do. So that really means we hold ourselves accountable to deliver the results our clients value most, which are really healthier employees and a controlled medical spend. So how does it work? This is a little bit about what our formula looks like. We have a 4-phased approach that carries us from deep immersion in our clients' population to data-driven strategic planning through execution, and finally at the end, really evaluation of how those strategies work. And then we ask ourselves, how can we do it better? What can we do differently? And we get back to work and really start that process all over again. So phase 1 really of identifying the cost drivers is where we analyze the organizational health data, including medical claims, pharmacy claims, prior authorizations, pre-certifications, biometric screenings, health assessments, to really accurately identify what those cost drivers are and iterate accordingly. In phase 2 is really where we deploy the client-centric spectrum of solutions. And these are action-based strategies to address each employer's unique needs, whether a purpose-built solution or it might be a pre-built plan that's a perfect fit. We find the best-in-class path to kickstart the employer's goals. Phase 3, this is really where the love of HealthJoy came in, because this is where we need to execute and we need to engaging participants and implement various health and administrative solutions to improve health outcomes and control medical spend. And then phase 4 is really where we look back and see how we did. We measure and evaluate the results to understand which programs and solutions produce the greatest impact. And informed by that data, we can adjust the strategies, evaluate cost drivers again to provide a positive outcomes using new information. So there's a spectrum of choice in self-funding, as many of you are aware. No matter where you are on the spectrum, from established to evolving or emerging, Nova meets our clients kind of where they are. We want to help them understand how having the right guide by their side can help them make wiser choices when it comes to managing risks, costs, and care outcomes. So there are a variety of options when it comes to plan design and developing strategies to best manage a client's bottom line. And honestly, it can be overwhelming. So to help our partners gain insight, Nova's developed the Spectrum of Health Plan Performance Management Opportunities. It's a guide to determine where a client may fall based upon their financial goals and the needs for their employee population. So imagine you're back in science class learning about visible light in the electromagnetic spectrum. Think of it this way. So the white light is really the company profile, demographics, goals, priorities, tolerance for change. The prism, that's the TPA partner. And then the visible light is really the creative solutions the TPA partner can offer and to the employer as well as their employees based upon that company profile. So Nova Spectrum of Health Plan Performance Management Opportunities shows the range of wavelengths and gradients of choice associated with a self-funded plan. Some clients take a traditional approach, others opt for an innovative plan design. But these spectrum elements can vary really across the continuum, ranging from an established point solution to an evolving model or venturing into emerging healthcare trends. Where a client lands may be based on several factors. So let's walk through each solution and gain more insight and take a closer look. So the first area that we take a look at really is the network, right? So you have the structured approach, maintaining a traditional network solution with your normal in-network and out-of-network benefits. Many people are transitioning to a hybrid model where maybe they have a physician and ancillary network and they might be doing a direct contract with a facility outside that, or doing reference-based pricing with facilities. And then other employers have really eliminated the contracts and the networks all in general and really have gone to an open choice model where they might be reimbursing based upon a percentage of Medicare. The other area is telehealth, right? So we've seen more and more of this since the pandemic, but really the more traditional approach is, e-visits with your existing providers, promoting maybe a 24-hour nurse line, but offering virtual visits that are covered under the plan with like current in-network existing doctors. The third-party vendor after-hours area is really where an employer may bring in somebody like a teledoc that might be able to support with office visits after hours, might be able to keep people out of urgent care for general medical, or even some are doing behavioral health and dermatologist type virtual care now as well. Really on the extreme side that you're seeing more of is really a structured telehealth solution with favorable copays and expansive access to services such as telemonitoring for chronic conditions. So we're seeing more and more vendors pop up that can support maybe diabetes virtually. It can really monitor everything that's going on with that member in real time. The next spot is wellness, right? So you kind of have organizational wellness where you might have discounts to go to the gym, and really maybe an internal committee within the walls of your organization promoting healthy rewards. The other one is more outcomes based, so rewards for attaining goals, lots of tools where they can access to health improving resources. Oftentimes a third party vendor, may be brought in for this. And then there's really the comprehensive well-being wellness program where there may be health coaching, there may be biometric screenings, there may be incentives tied to improving biometric screening results over a year after year period. The next area we touch on is medical management. So there's the traditional approach, which just has your normal pre-certification lists. You may have case management and disease management services. Then there's other creative solutions. So customized strategies to provide solutions to meet disease or utilization specific needs. And then there's also expanded solutions for care, right? So medical tourism, a big buzz in our industry where there's significant savings for maybe someone traveling outside of the country for a certain type of care or surgery. And the employer is actually sharing in that savings back to the member to try and drive that utilization. The next area is really the pharmacy management. So this is what's driving the cost on a lot of health plans. The traditional PBM would have your tiered benefit structure based upon brand and generic pharmacy solutions. Discounts are secured by the PBM and they might be passed on to the employer. Then there's the integrated PBM that we call it, which is more of the highly managed formulary, driving utilization to those lower cost generics, really pushing utilization of mail order. Maybe it has specialty RX programs and there's medication adherence support. And then the consumer directed model is really offering incentives for cost savings based upon consumers' choice of pharmacy and lower cost alternatives, which includes shared savings with members such as, that international sourcing. The other area is the benefit design tier. So a lot of employers, they want to go self-funding, but they think that it might be overwhelming. So maybe level funded is a way for them to get their feet wet. A lot of smaller groups might stay level funded, but it's a way for an employer to have a look-alike of what is a fully insured plan, but you have a strong TPA behind the scenes managing all the moving parts. The standard design, so many self-funded employers, when they do make that change, they want to just duplicate their benefits year one, which a good TPA would be able to do. And then maybe over time, they transition to over that more highly customized plan design. Once we start identifying unique cost drivers or utilization patterns within the plan, we can transition from a standard design to a more highly customized. And really then the last piece is reimbursement, right? So how can one of the reimbursement accounts, whether it be an FSA where you're putting aside pre-tax funds for a variety of expenses, or is it an HRA where an employer is taking advantage of some tax benefits to put dollars into an account where the employees can help reach the deductible? And then more and more common, we're seeing the HSAs where the employees and the employers can put taxable favorable dollars into an account to use for qualified medical expenses. So this is a lot, right? So how do I move all of these pieces around and really make it seem strong and effective for the membership? A lot of it starts with, the employer's tolerance for change, right? They know their employees best. Wherever their client falls on the spectrum of the health plan performance management opportunities, they need an experienced partner with demonstrated success that really understands all of the nuances associated with their specific plan population. And with the right partner to engage in conversations, each opportunity for data review provides another opportunity for that conversation around improving health plan performance, but also the membership health outcomes. So at the end of the day, if you don't have the right partner to really put all of these moving pieces together, then there's a good chance that your goals aren't going to be accomplished. And that's why Nova's really chosen to partner with HealthJoy to help bring all of these solutions together that make it easy for the member to navigate and have access to resources at their fingertips 24/7. And with that, I'm going to hand it over to Dave to show a little bit about what that member experience would look like.
Awesome, Todd, and thank you so much. You know, you hit the nail on the head, and I just want to reiterate, this has been an incredibly exciting time for us. I've been with HealthJoy for almost 4 years, and where I've seen the industry go, where I've seen our organization go over those 4 years is truly exciting, not only for us, but for our partners, the clients, and the members, because as the market changes, as demand changes, we are evolving. We're getting bigger, better, faster, and smarter, and we are able to pivot. So I can't thank enough Todd and the Nova team, because we are being incredibly selective in who we want to work with. We are not partnering with everybody. And as you heard from Todd, they're doing a lot of incredible things at Nova, and that is what really appealed to us in the first place. I've known Todd and that team for a number of years when I started off in the wellness side. And what we are about to do together is incredibly exciting, and that's obviously why we're here today. So as I kick things off, I really want to start off with, you know, why we're here. You know, why HealthJoy? Why did we come to be? And it's because of what we are hearing in the industry. And I know this is nothing new to many of you on this organization. And I know there's a mix of consultants, and there's a high level of HR leaders and CFOs in organizations. So the challenges we hear are across the board when we are going out and talking to members and even doing surveys to get an unbiased view. And what we hear is that, listen, healthcare is complex. We know that. I mean, we hear it all the time. We experience it every day. But it's incredibly fragmented. And when you think about all of what we have done in the last 3, 5, 10, 15 years to develop new cost containment strategies to mitigate risk and control costs, listen, at the end of the day, they are all great solutions. They work if people use it, if people are aware of it. But we hear loud and clear that people and HR leaders don't even believe that their employees have any clue what benefits are being offered, despite all of the hard work that they have worked, you know, that entire renewal process to bring to them, and you as the consultants to go out and vet out to say, here's what's going to work. Let's get this implemented this year. Members are not taking advantage of that. That unawareness, that lack of awareness, is leading to a lot of lost productivity for HR. We know what you are all tasked with every single day. I don't know how you do it, but what we hear is that most of the hours spent in a given week, when you break this out, it's about 9 hours a week. We heard from HR leaders across the country, 9 hours of their week is spent fielding general benefits questions. Think about that. After open enrollment, 9 hours a week on average, sure, later in the year is a lot more, they are spent taken out of their more business critical needs to address very simple things that members should know. That is an issue, which again leads to what Todd was highlighting too, cost containment. And 85% of employer groups say that MSK is a top 3 spend, yet there hasn't really been a very viable MSK product in this mid-market space, let alone other spends as well. So that was what we heard loud and clear as the challenges. But what we did like to hear is that despite all of this, one of the top primary strategies as people were in the pandemic last year, entered in this year, in the foreseeable future, was that they wanted to provide tools that was going to help members make better healthcare decisions. And I know we have heard that before, but why is it not working? And why is that so important now more than ever? Well, here's why. When you start breaking down your spend, and I don't want to get into the weeds of this, but let's just make it very simple. You have your fixed costs and your claims costs, which are about 80% of your spend on average. You break that 80% of your variable cost of claims down, 60% come from standardized services, 30% come from planned in and outpatient hospital services, and then you have 10%, which are unfortunately emergency or unplanned, where you literally have no control over it, just happens, and we expect that. So what does that mean? That means 90% of your claims right now, 90% are planned controllable events. Say that again. Planned controllable events, meaning members have the opportunity to make a decision before they do anything. And my question to everybody is to start thinking, are they actually doing it? Do you have tools in place that are helping them? And many of you do, but we hear loud and clear that the experience is leading to low utilization, lower engagement, low adoption. And unfortunately, we continue to see claims go up because people aren't taking advantage of it, or they're not using it as it was designed to use it. Or as we saw earlier, people don't even know where to go because there's so many different things. They don't know what website, what mobile app, what phone number to call, and they just do what they've always done. That is an issue. So what HealthJoy has done, for those that aren't familiar with us, this will be very short and sweet, is number one, create a very simple experience. That is what we wanted to accomplish from the get-go, right out of the gate. How do we create an experience that everybody is used to? Right here on our mobile device. Why? Who leaves home without it? Nobody. The moment you do leave home, people are usually freaking out. And the first one, I'm the first one to admit, when I don't have my phone, I'm almost freaking out. Why? We communicate with each other. We do our research. We pay our bills. I'm doing my emails. I'm talking. I'm texting. This is how we communicate and interact and get things our entire workday and in every aspect of our lives, right? The moment I need a car, I'm hitting Uber or Lyft. The moment I need to order food, I'm hitting Grubhub. Those industries have flipped the market on their back because they've created a very simple, easy to use interface for a member that gets them by a click of a button to come into a great experience. And then they are guided and navigated through a very intuitive process to get them to what they want at the appropriate time, getting the lowest cost options, they're getting reviews, and they're having a great experience. And again, that experience, you're going to keep hearing me say that, and Todd said it a couple times. Focusing on the experience and working backwards is going to solve for most of everything. Because when members have a good experience, they want to use it and they want to keep using it. And if we're able to engage people and they feel confident to want to come back into us, and we're staying top of mind to remind them about what benefits are being offered, which now you guys are all looking like champions because what you put in place because you knew would work is actually being used, that is a massive win. So HealthJoy is not only simple, but it's smart because we use artificial intelligence to have more conversations than any other solution in the industry. Now, that artificial intelligence is not meant to scare people because we are not removing the human element. At any given point, if somebody would like to interact, talk via chat or phone to a live human being, a concierge that is an expert in those benefits that are being offered, they have the ability to do so. But listen to this. This is why this is so powerful. Of the 450,000 members that we service today, over 95% of all of our customer member interactions are handled through the chat functionality. Nobody wants to pick up the phone. Nobody wants to respond to an email. The stats show that. I know, Todd, you love this, so I'll say it, but it's crazy when you hear it. Last year alone, there were 10 trillion text messages sent. 98% of those are read in less than 2 minutes. Yet less than 20% of emails are opened, and less than 14% of phone calls are even answered without being placed on hold. So we're saying still rely on those methods of communication through email and phone. We do that. But if you want to engage people, you want to communicate, and you want people to execute on these strategies, you have to get in front of them in ways in which they want to be communicated with. Chat and text. That alone is allowing us to have more conversations, engage more people, drive better program adoption, higher utilization, and better engagement, not just right out of the gate, but through the entire course of the year. And I like to share this real quick because this is what we do at our core. And there's a lot on here, and I want to get through this to talk about the next step with this Nova integration, because this is the game changing. But for the HR leaders that are on here, this is one broker partner of ours in their book of business that we have been working with for about 3 years. 76 of the entire population, almost 15,000 eligible employees, 3/4 of them are actively engaged with HealthJoy. Over 50% of them are coming in and communicating, engaging with us every single month. That is powerful technology to be able to communicate, engage, and remind people of all these programs to ensure that they're taking advantage of it, okay? Now, at our core, that's what we do, and we do it incredibly well. But when you think about that experience, it is still a reactive model, right? We are still relying on members to come to HealthJoy when they need something. We just do it way better than anybody else because we've created muscle memory with the proactive outreach, the push notifications, the interface, the ease of use and simplicity all in one place. But how do we make it proactive? And when you think about the current healthcare journey, somebody that has knee pain that ultimately needs a knee replacement, the cost can be pretty astronomical if members aren't making well-informed decisions, right? They're just being told where to go. And usually most people, I'm not saying everybody, most people are just following the directions of the doctor, when unfortunately the doctors don't understand what part of the benefits are being offered. If there's better options, there's better cost options, higher quality areas, whatever it is. They're not gathering that information so members can make that decision on their behalf. Well, that's what we are doing now with Nova. What we are now doing is ingesting data and claims to take the reactive model to a more proactive model. Meaning, at the moment of a time a member needs to make an appointment for knee pain, we get that insurance verification request. Why? Because that doctor's office is trying to verify to make sure that, in this case, John has health insurance. Am I going to get paid? Yep, you are. We get that feed. Now we can proactively engage member. Listen to this. At the time it matters most, right? During the decision-making process, get in front of the decision. We also do that at the pre-certification at the time, in this case of an MRI, at the time of the procedure being scheduled. And our concierge team is doing all the cost checks, all the quality metrics to ensure not only the surgeon that they're getting it done is the best, they've performed it more times, but the facility has incredible quality metrics too. And when you do that, because the information's out there, when you do all that for the member, which is incredibly exhausting, by the way, if you've ever tried it, unfortunately, why most people don't do it is they try it once and they just give up. We do all that on the behalf of the member. We take those headaches away, the challenges, the barriers, the frustration, and the fear. And when we do it, the potential savings and impact to drive and execute for better outcomes is right there at our fingertips. And the only way you're going to be able to do it is through a proactive approach. And I wanted to share this because we are doing this today. We've been doing this integrated approach for about a year now. This TPA relationship with Nova is exciting because we're entering into the new season. And I wanted to share a story because this is happening weekly. But there was a member last week, maybe it was 2 weeks ago, that had a surgery scheduled at a local hospital. They were scheduled. Our team gathered that pre-cert information and was actually able to find out some information to then be able to go back to the member and say, listen, we want to understand or make you understand of what your options are, because although you have this procedure scheduled, here's what your out-of-pocket costs are going to be, the impact to the bottom dollar, but we also want to let you know of an option that you are not taking advantage of that is part of your plan that your employer group is offering to you. You have the option to go to another facility that's higher quality and a bundled price. And by the way, if you use this option, you pay nothing. So not only is it nothing out of pocket for the member in this particular case, but it's saving the employer for this one particular opportunity, $12,000. That one opportunity, that one conversation paid for the entire program of HealthJoy for the entire population for that organization. That is extreme. But when you start adding up all these common conditions, man, there is an opportunity to get in front of some very common things and help members make better decisions that are best for them, their family, and their checkbook. And then the last area, because I know we're coming up to the middle of the hour here and I want to be respectful, is the case management. You know, this is iteration number 2 of what we're doing. The proactive outreach during their decision-making process to get in front of decisions. We are also understanding there's a lot of people that have comorbidities, that have chronic conditions that need more critical attention to be engaged with a case manager to help them, a professional clinician. Unfortunately, low adoption and engagement because people are not responding to emails or picking up phone numbers they don't recognize. We are gathering that intake process and building that into our workflow and our outbound campaigns to be able to now have conversations with members to remind them of the incredible benefits and resources that are being offered, and now bridge the gap to getting them connected. And when we're doing so, people are now living a better quality of life. It's much more efficient for them, more efficient for the plan, and it's saving a lot of money. So to wrap this up, we are incredibly excited about this partnership. And our goal today was to keep this very high level. We could have talked for probably 2 hours. And forgive me if we're talking fast, but we're so excited and there's so much to cover. we want to give you a taste of what we are doing together and why this is so exciting and game-changing, and why we want to encourage people to want to raise their hand to learn more. Because our technology, along with Nova, this is 100% customizable and then 100% personalized down to the member. We want to build this based on your specific needs, what you're looking and how you're looking in the future, so that we can now fix this healthcare system by giving members a very simple, centralized way to access information and have professional concierges behind the scenes that do all of the heavy lifting for them and use proactive technology to drive better adoption and better engagement. So I don't see any questions, which is great because we're about a minute past and I want to apologize. But thank you so much. I'm going to pass it over to Todd just for, quick, closing comments, but please, please, please reach out if you have questions to Todd or myself, but we will be reaching out to you because we do encourage everybody to want to learn more, because there's an absolute demand, especially in today's world, for a digital first approach. And we couldn't be happier with our partnership with Nova. So again, thank you, Todd. I'll let you say your parting words.
Yeah, no, I'd like to thank everybody for taking the time out of their day to learn more about this. To iterate what Dave said, we're extremely excited. Our nurses love making an impact with our members. But what they don't want to do is spend an entire day just making phone calls to get sent to voicemail. So being able to engage with members at their fingertips, at the right place, at the right time, or surrounding the right conditions, it's really going to allow us to more effectively help manage trend, which will ultimately, control employers' bottom lines. So again, thank you everybody for taking the time today. And if you guys have any questions, feel free to reach out to Dave or myself, but have a great rest of the week.
Take care. Thank you so much.